As the world grapples with the deadly outbreak, people have grown anxious about being in crowds or traveling in confined spaces like airplanes.
Transportation correspondent for Axios, Joann Muller, is joining us now with more on that. So, I mean, in a way, you can kind of understand. We've got, Washington State encouraging people to not gather in groups larger than 10.
Right.
And so then you think, well, what does that mean for the rest of us, right? Because we know a lot of people have not been tested yet. So what kind of impact is this outbreak having on the travel industry?
Well, thank you for having me. I think if you take a look at some of the pictures we've seen of people traveling through airports or on airplanes, a lot of people are skipping the trip. We're afraid, right? And I think that this has a little bit of post 9/11 fear associated with it. People are just not sure what to do, and they're staying home in many cases.
Yeah, our correspondent who's based in Rome, Seth Doan, just a couple of days ago, tweeted a picture of an empty plane.
A Delta flight back to Italy, there's no one on the flight.
On the plane,
a couple of people
just
and him.
Maybe 2 or 3 people along with himself. And so the question, I guess, for travelers is, what is the airline industry doing for travelers who had flights booked within this period? In other words, you booked early. For example, my fiance's parents love to book like months in advance. And so if you've got a booking and you don't want to go on with that booking, what happens then? And I guess, what should people be looking at insurance going forward?
Well, most of the airlines have been trying to be super flexible with their passengers. They are offering to allow them to change with no fees and fly at a later date, which is good. I believe that I think it might be Virgin Atlantic has gone overboard and said, we'll give you a full refund. I'm not 100% sure on that. Check with your airline, but insurance is not always a protection. Some insurance policies that I checked are very explicit that they do not give you a refund or not protection against some sort of epidemic, which this could qualify. The other thing is that if you book now, it's known that coronavirus is out there, and so they also do not pay you back for known cases. So I think it's a little risky. You have to decide if you're willing to take the chance.
Yeah, I was talking to one of our producers who's upstairs, and she said that, now I'm not sure she had travel insurance on a trip that she's planning on taking, but she said that she was told that if you booked prior to January, at least with this company, then they would cover it. But after January, coronavirus is not considered an unforeseen event, and so you might be on the hook for it. The other question that people have is about airplanes and the air on airplanes. We just showed a bunch of video of people in airports with masks on. I spoke to somebody recently who was not really sort of paying attention to the whole coronavirus story and got on a plane and saw tons of people wearing masks and wondered what was going on. Can you please sort of, if you will, clear the air about the quality of air on an airplane?
Sure. Well, you think back many years ago when people used to be able to smoke in the back of the plane, and the whole plane would be smelling like smoke. So we assume that germs are also flying around in the plane. But today, many airlines, all airlines, use these super clean HEPA filters that really circulate the air out of the plane. And the air is not really the problem in the plane. The concern would be hard surfaces. So someone sneezes or coughs, then touches their tray table or their armrest or the overhead luggage carrier. And so also the restroom, of course. So what airlines are doing now is they're doing some extra wiping with alcohol cleansers and bleaches. They're also, some are using like a fogger, like a disinfectant spray that will go down and land on those hard surfaces. There's also entrepreneurs who are working on robots that can actually go down and use ultraviolet light, go right down the center aisle and have these arms that spread over the 2 sides of the seats and tables and use ultraviolet rays to kill the disease.
Interesting.
Very interesting.
Yeah.
Joann, always great to have you. Thank you very much.
Thank you.